Good afternoon. My name is Dr. Saul Levin. I'm the Vice President of Science, Medicine and Public Health of the American Medical Association. I'm testifying today to express our support for the Illinois Obesity Prevention Initiative. I'd like to thank the chairpersons, Dr. Javette Orgain and Reverend David McCurdy and the committee, and the elected officials here today for your time this afternoon. I hope that this information will be useful to you to consider the future direction in combating obesity in the state of Illinois. I'd also like to thank Janet Williams, the Director of EPA Grants, and our public health specialist at the AMA for helping to organize my testimony here today. The obesity is a condition that is linked to numerous negative health outcomes, including diabetes, joint deterioration, depression, anxiety, high blood pressure, coronary artery disease, stroke, and cancer, as to name a few. As part of its prevention and wellness advocacy agenda, the AMA recognizes obesity as a major public health problem and supports a variety of initiatives. Physicians can play a key role in preventing obesity by assessing both children and adults to adopting healthy eating and physical activity behaviors in their life to help maintain a healthy weight or lose weight if needed. This problem is complex and works for one segment of the population which may not work for another, so we need to understand different ways of doing outreach to individuals. A solution for Illinois needs to be comprehensive and recognize the cultural norms of all our populations living within the state. The AMA believes a successful statewide plan is one that includes surveillance and data analysis, school-based and community-based policies that support healthy eating and physical activity, media-based public education and the training of healthcare professionals to screen, counsel, and treat the behaviors that contribute to overweight and obesity in our patients. The AMA believes that Illinois needs to strengthen its school nutrition and physical education policies. These include school-based initiatives such as improving the nutritional quality of school meals and adopting evidence-based nutrition standards, and implementing comprehensive programs to help young people develop skills needed to choose healthy dietary patterns and adequate physical activity. The AMA recommends the following community-based strategies: requiring fast food and chain restaurants to provide consumers with nutrition information on menus and menu boards, banning the use of trans fats, especially in restaurants and bakeries, and reducing the amount of sodium in the food supply, and encouraging government to support community recreational facilities in high-risk areas through the use of tax incentives and grants. Finally, the AMA recommends educational training for healthcare professionals of how to effectively screen, counsel, and treat the behaviors that contribute to overweight and obesity in their patients. Specifically, the AMA recommends educating physicians and other health professionals about prevention management of overweight and obesity, including assessment and counseling methods, and on routine determinations of body mass index percentiles in both children and body mass index and waist circumference in adults. I'll quickly close one. Increasing research on the relative efficacy of clinical and public health interventions. And finally, encouraging evidence-based clinical preventive services. We look forward to working with you in the future. Thank you very much.